Hi, I'm Katie Johnson, health educator at Mayo Clinic Health System. Children these days face so many problems, and people wonder how to help them get through. The term resiliency pops up often, but what does that really mean? Joining me now is psychotherapist Anita Valchek with Mayo Clinic Health System. When you say someone is resilient, what does that actually mean?
Resiliency is the ability to recover quickly from difficult situations, to adapt to adversity, trauma, or other sources of significant stress. So I think that it's misunderstood that stress doesn't affect children the way that it does adults, and that's not really true. It can impact the child as much as it does an adult. How they respond to that becomes really, really important. And so allowing them the opportunity to be able to express through that process is super important. Resiliency can turn victims into survivors and allow survivors to succeed.
So what can adults do to help kids become more resilient?
It's really important for kids to feel safe to communicate feelings. Communicating feelings can be as difficult for children as it is for adults. You want to make sure that your children stay connected with other people. Being able to communicate feelings is really important. One way to do that is to teach empathy. By helping other people, it can distract and empower them. In addition, routine, adequate sleep, good nutrition, and old-fashioned downtime can support good health. Accepting change can be challenging. However, it's a normal part of life.
What can adults hope to see by working on these strategies?
By allowing children to communicate their feelings, it should reduce the number of lost school days, illness, emotional outbursts, and feelings of worry and fear. In addition, it should improve the relationship with adults that are providing care for them, as it allows them to communicate openly and increase the understanding that they experience feelings in the same way adults do.
So what happens if these techniques aren't enough? What should people do?
Communicating feelings and working through difficult times is a hard task for anyone. It is especially difficult for children. It's important for adults working with children to understand how to do that in an effective and healthy manner. If an adult is not able to do this effectively, they can seek out help from mental health professionals. There are many adults who work in the field with children on a daily basis. These adults are able to help model the art of resiliency by validating emotions and comforting children so they know they are not alone.
Thanks, Anita. This will be great for families who need a little extra help. Resilience is an important life skill that can help children adapt and succeed in life, despite experiencing challenges along the way. If you'd like more information about resiliency, search mayoclinichealthsystem.org or go to the resource on the screen.